All right, so welcome everybody. Appreciate you coming here on this hot, very hot August day. I'm Andrew Berman, Executive Director of Village Preservation, and we're here today with Save NYEEI and Ear Infirmary, both doctors and patients, our friends from the Historic Districts Council, and Assembly Member Harvey Epstein. And we're going to talk today about this effort to try to save both the NYEEI and Ear Infirmary's historic building on 2nd Avenue and 13th Street, as well as the services that they've provided to New Yorkers for over 2 centuries now. I'm going to speak first, and then we'll hear from the doctors, the assembly member, patients, etc. Very quickly, for those who don't know, the NYEEI Eye and Ear Infirmary is the oldest specialized hospital in the entire Western Hemisphere. Founded in 1820 by Edward Delafield and John Carney Rogers. And those two men were considered the fathers of ophthalmology. At this hospital, they performed what was the first successful cataract surgeries in the Western Hemisphere, restoring sight to patients. And in the 200 years since then, they've served literally countless people, especially the visually and hearing impaired. And made such a tremendous difference in terms of the provision of health care to New Yorkers and well beyond New York. And they're clearly at a turning point now in terms of the future of the hospital, and it's a turning point that we are very, very concerned about. Since 1856, the NYEEI Eye and Ear Infirmary has been located at the corner of 13th Street and 2nd Avenue in that incredibly impressive Richardsonian Romanesque building that stood on that corner for over 150 years. Built in stages from the 1850s to the early 20th century, that building and the services that it provides has attracted the attention of everyone from Francis Ford Coppola, who used it as a setting in The Godfather, to Helen Keller, who spoke at the ribbon cutting in 1903, testifying to the fact that this was a place of such paramount importance in terms of the provision of health care and the evolution of services to people with visual and hearing impairments over the years. We do not want to see that go away. We do not want to see it disappear. We don't want to see the building disappear. We don't want to see the services disappear. We don't want to see the people that they serve having to go farther afield or lacking in what is this really invaluable provision of health care that they've received at this corner in the East Village for over 150 years. And so we're here to say to the city, protect this building. And the doctors and the patients and other folks today are going to speak to the issues surrounding the provision of services and making sure that those are not lost either. So the first person I'm going to ask to join me up here to speak is Dr. Richard Coughlin from Save NYEEI Eye and Ear Infirmary.
I'm Richard Coughlin. What I'm going to do is try to frame the experience of the Eye and Ear Infirmary, try to draw you in after 200 years. And I can do that because I'm the grandpa of the infirmary. I'm the oldest, I'm the relic, I'm the oldest attendant at the Eye and Ear Infirmary. And I'm going to give you a sense of what the infirmary has been and what it is now. I've spent my entire 52-year career at and with the NYEEI Eye and Ear Infirmary. Give you a little data marker there. That's 25% of the entire history of the 200 years of the Eye and Ear Infirmary. So it scares me too. I founded a number of departments during my career, unburdened by layers of institutional management and the peculiarities of oversight for compliance. Historically, we've had the freedom, the partnership, and the encouragement of the NYEEI Eye and Ear Infirmary management to innovate essential services, patient services, and to research and develop seminal ophthalmic tools. And importantly, we've been able to develop new products. That's how quickly the infirmary could develop and innovate. And one of those, as an example, was the NYEEI Trauma Center. Prior to that, there was no acute care center, particularly for our uniformed services. And by the time we had evolved that center, we had patients being helicoptered to the 23rd Street heliport. We have a red phone, active 24/7, residents and attendings volunteering for this process. Volunteering, all night operating. So that's the response that we've had, and that's the kind of services we've provided. The infirmary also established the first specialized-based bioengineering and computer science division. And in that division, remember this is a small place, we developed some of the seminal ultrasound devices used in diagnostic ophthalmic ultrasound, and we developed corneal topographic mapping, a computerized mapping product that is used in every LASIK procedure and virtually every corneal transplant throughout the world. Presently, I'm the co-director of the Cataract Division of the New York Eye and Ear Infirmary. After 52 years, I've had the enviable elements of relationship with this whole community. Close friends, you may remember Abe Leibwald, Second Avenue Deli, close friends, family, operated in all of them, many others. That's what happens when you stick around for 52 years. But, importantly, I'm not unique. I'm not standing here. There are people in this room as unique as I am, and there are many others at the Eye and Ear Infirmary. And the New York Eye and Ear Infirmary was born and bred in volunteerism. For many years, many of us, including his husband, I remember very well, volunteered and gave a day of their time freely, no recompense. Almost everybody who does this, Buxton, his father before him, gave of themselves, and it was completely voluntary. We gave up a day in our office to teach, to do research. And this was ongoing for many, many years. There was a culture of collegiality, nurtured by the institution's 200 years of maturation. And the New York communities have appreciated that, and they benefited from it, very much so, because it's all about service. The building at 13th Street and 2nd Avenue, it represents a distinctly historic edifice, and it should be landmarked. But we're here to challenge Mount Sinai. Mount Sinai, to challenge them to move beyond the bland concepts that would make extinct the eye and ear departments and fracture them into at least 4, and maybe 5, who knows, various disparate locations around the Manhattan. And that is not the New York Eye and Ear Infirmary, although they will tell you it is. That will diminish the teaching program and importantly alter the infirmary's historic mandate, which was to have services within one edifice, one building, and provide everything from soup to nuts for eye care. And we could do that, and we did it for 100 years. Now, what Sinai is suggesting is amongst all of those locations, they will have the attendings, the patients, the students, residents, and fellows going from one place to the other to the other. And from that, we are still missing an emergency room. The Eye and Ear Infirmary's had a specialty emergency room for well before I came there. And that was very important. And I don't want to understate that. Having a specialty emergency room for ophthalmology is the rigor. You must have it. The infirmary is marked by many firsts. The first black ophthalmologist, David K. McDonough, a slave no less, a slave, was the first black ophthalmologist in the world. And he practiced at the New York Eye and Ear Infirmary from 1847 and was in the same building right down the block. Also, one of the pioneering women in ophthalmology, Virginia Lupkin, attended the infirmary from the 1950s to the 1980s, and she opened the door to women in ophthalmology. I'm sad to say there were not many women in ophthalmology prior to her entry. I don't want to take much more time, but I will finish by telling you this. At one time, there were 5 eye hospitals in the boroughs of New York, and now there's barely 1. Thank you.
Thanks very much, Dr. Coughlin, and now we're going to hear from our Assembly member, Harvey Epstein, who, along with State Senator Brad Hoylman, has been supporting this effort, as he has so many other things that we've partnered with him on. Harvey.
Thank you, Andrew, and thank you for giving that 50-year history of your life and also the history of the institution. And on the personal side, both my wife and my daughter went there for surgery, so it is something not just that impacts the city, but impacts me personally as well. And really, we wrote a letter in May to the mayor and Chair Carroll to talk about why we needed to preserve this building and the physical structure of the building, but the services for people who go in that building are Andrew, is probably more important, maybe not, to the building as well as physical structure. This we've seen across our city, state, country, the closure of hospitals and healthcare facilities. And we've seen in the last 20 years in New York City alone. We almost lost Beth Israel Hospital on First Avenue because they wanted to close right before the pandemic. And this is where people get care. This is where people who need help go. And if we lose the services and we lose the building, we've lost everything. And what we're going to get in result is, another high-rise, another condo that's selling for millions of dollars. And while we do have an affordable housing crisis, we have to say the crisis isn't really for the $1 million apartments. The crisis is in the affordable space where we're seeing no development. So I'm here to stand with you to say we need to make sure for the mayor and landmark preservation preserve this building. We're also here for the fight to ensure that the services that are happening inside remain. And that fight that we took on for Beth Israel now, 5, 6, 7 years ago when we started, people said there's no way you're going to stop Beth Israel from closing. They're going to sell the building and it's going to be gone. And we said we're going to fight anyway, and we fought. And I'm sure the pandemic helped us a bit, but we won. So there is no struggle that we're not going to engage in to preserve the services for our community and what our people need. And this facility is something that we need, not just for people who live in the East Village or the Lower East Side, people who live in the city of New York and around the country. So thank you for doing this.
Thank you so much, Assemblymember Epstein, for your leadership on this and so many issues. And next, we're going to hear from Dr. Paul Lee, also from Save NYEEI and the Ear Infirmary, who's been helping to spearhead this.
Thank you so much for having me. I am the president of the New York Eye and Ear Ophthalmology Alumni Association. I trained at New York Eye and Ear Infirmary, did my ophthalmology residency there, my glaucoma fellowship. Dr. Buxton and Copeland and Ms. Shippen were all my teachers, and I made the best friends of my life there. I'm also the chief of ophthalmology at the Bronx VA, and I'm also the associate program director of the residency program, so I wear many hats. I'm here as a representative of the alums, and I'm here as a representative of the trainees. First of all, I really want to thank Andrew Berman. We would not be here today without him. I fortuitously got connected to him through a patient of mine who's here today. And if we lose this battle against Mount Sinai, we can preserve the physical building where so many patients were taken care of and so many doctors worked so hard. And if we can preserve that physical structure, a lot of us will sleep better at night, because it would break our hearts to see that building demolished for a developer. So I can't thank Andrew enough. He worked expeditiously. I had one phone call with him. I remember I was standing in the corner here. I was attending glaucoma clinic. I had a phone call with him. It lasted about 15, 20 minutes. He said, let me do some research. Within 2 weeks, he had a letter, well-researched. He had his 4 groups behind the letter to the mayor's office. A week after that, we had 4,000 people supporting building marking costs. So really, thank you so much for supporting us. I would like to speak on behalf of the trainees. All of us here have worked, or the doctors here have worked hard training doctors, and a lot of us trained there. And we are a world-class training institution. We're very unique, as Dr. Coughlin had emphasized, in that we provide all subspecialty services under one roof, which is why we're able to train world-class ophthalmologists. I'm not saying this to brag, the top surgeons in New York City have spent time at New York Pioneer. Either they did their residency there, fellowship there, or shadowed a doctor there, or did research there. Not just New York City, but throughout any major city you go to, you look up an ophthalmologist who's one of the top, they're going to have some connection to New York Pioneer. As the associate program director, I've made this clear to my superiors, because I'm an associate professor at Mount Sinai. I've made this clear to my superiors in public, in private, and I'm saying it now. If we move and are split up, the program will suffer. We will not be able to train world-class ophthalmologists as well as we have. And I've written emails, I've had face-to-face meetings, and the training mission of New York Pioneer is so vital to its mission. And if we are moved and split up, it will suffer. So thank you for your support. If we can get more people to support this, we really appreciate it.
Thanks so much, Paul, and for all your hard work and your kind and generous words. And I want to acknowledge again the Historic Districts Council, as well as East Village Community Coalition and Lower East Side Preservation Initiative, who joined us in sending that plea to the Landmarks Preservation Commission to preserve this building. Our next speaker is Dr. Doug Buxton, also from Save NYEEI.
If we lose the building, we lose the program. The teaching won't suffer at Atlantic. Put yourself in the position of the patients now. When a patient calls on the phone and says, I can't see, you can't ask the patient, well, what part of your eye is not working? Is it neurologic? Is it diabetes? Is it glaucoma? Is it a cataract? All the patient knows is they can't see well, or they're seeing double. And why are they seeing double? So we ask them, they don't know. The infirmary can answer that question the way it is constituted now. We have the synergy. We have every service there. We were ranked number 10 of New York residency programs in the country as recently as this year. And we're slipping, of course, because we don't have the passion and the synergy that we've had in the past. But we're still the 10th ranked program in the country. And it's because of that service that we give. So I want to emphasize the loss of the patient. So they have a retina problem, they arrive in the emergency room, they have to go uptown to 180-something Street. If they need surgery, they have to go over to 25th and Broadway. If they're going to be seen by the residents, they're going to be on 25th and 2nd Avenue. And the faculty is going to be on 25th and Broadway. They don't even plan to have the faculty in the same building as the resident program. The program will disintegrate. We got a response back when we complained about this by the president of the hospital. The program is not a building. The program is a concept, an idea, it's a service. But without the synergy of the geography, without the campus, the program, as we and Dr. Coughlin and Lee have outlined, cannot survive. It'll just be a lot of disparate eye services throughout New York. So that is the beauty of the infirmary. It's more than a building. It's more than services, it's synergy. It's a culture of education and patient care. My father started in the infirmary in 1952. I started in 1986. Across the street on 13th Street, that was the first time I bought my own sandwich alone. I used to do rounds on Saturday mornings with my dad because back then when you did corneal transplants, the tissue wouldn't last. So we wound up doing corneal transplants on Friday, seeing the patient on Saturday. I have a tremendous connection to this area of New York. I did my internship at St. Vincent's, that also closed. But I urge you, I implore you, I plead with you to value the experience, the service, the culture that we have in this building and help us preserve it. Thank you.
Thank you so much, Dr. Buxton. I think all of the doctors have painted a really vivid picture here. But we're also going to hear from a patient who can speak from that perspective to the experience of what the New York Eye and Ear Infirmary has offered. So we're going to now hear from Michael Jasek. Come on up.
Good afternoon, everyone. I run a nonprofit called the Relationship Foundation, And we have a curriculum and a book that schools are using now in New York that develops critical thinking, empathy, and respect. And it protects the children's psyche from all the stress and trauma. And let's face it, today, parents, children are on edge. And I've been developing this for 15 years. About 5 years into it, my retina detached. I was walking up 7th Avenue and suddenly I could only see what was above. I went to Bellevue where residents stuck flashlights in my eyes for excruciating pain, and eventually I went to emergency the next day at New York Eye and Ear, and Dr. Ronald Gentili repaired my retina, one of the teaching professors. And he has looked after me along with other physicians for the last 12 years about, and it's allowed me to continue my work with schools. And the time that I've spent in the clinic, and I have been in the clinic because I've spent all my savings on the project. So I am below the poverty line, but I am wealthy in doing something I believe in that gives me meaning and purpose. And I want to contribute to the children in the schools in New York and beyond. So having my eye health taken care of by the infirmary has been virtually life-saving. And the thought of having to run around different parts of the city while the conglomerate that wants to chop it up is pretty frightening. And it's even more frightening when I think about the poor people and minorities who go to the clinic, who I met many times and had conversations where we said how much this meant to us. I'm very lucky. I have a rent-stabilized apartment a couple blocks away, and I'm on Social Security. So I didn't have the expense that it requires for other people. But if I did have the expense, my nonprofit would probably not be in existence because I've used all my savings to keep it going. So the infirmary has played a part in my mental health and also contributed to my well-being such that I can keep my program going at the Relationship Foundation. So I'm seeking to do public service. The infirmary does a public service that cannot even be described. I don't know how much more I could say about it. I'm one person. I'm sure there's tens of thousands, if not hundreds of thousands of New Yorkers who would agree with me that that hospital should be preserved. And as an aside, in order to kind of help my program develop, I became a tour guide. And so I know New York very well. And so it's a historic building, and it should be protected under landmark preservation on top of everything else. There are so many multiple reasons beyond what I have to say here as to why that hospital should stay, and I look forward to rallying around organizers and contributing whatever I can to make sure that the public, not only in New York, but maybe nationwide, the whole country should know about this, this move, which I won't give an adjective to it, because our program teaches respect and non-judgment. And so let's just say on a personal level, I feel really disappointed, upset, I feel worried and concerned. And I'm grateful that I've been asked to speak here, and I hope that what I have to say today and what I imagine many, many more people will say will convince whoever is running the corporation that this is a move that is not in the best interest of New York and that people deserve health and well-being in every aspect of their lives.
Thank you very much. And just to sum up, and then we'll open it up to questions, I think what you've heard today is that preserving the building, preserving the institution, preserving the services that it provides would really be a win-win-win for New Yorkers, for this neighborhood, for the patients it served, for the generations of people that it served over the years, for the doctors who put their blood, sweat, and tears into this institution, and for it to be destroyed, for what? We'll get a high-rise glass condo on the corner of 2nd Avenue and 13th Street, just what New York City needs more of. We will lose an incredibly important piece of our city and our country's history, and we'll lose incredibly important services which will impact people's lives in the process. So we hope the mayor will listen. We hope that the folks running the hospital will listen, and we hope that this will have the intended effect of saving the New York Pioneer Infirmary. And I think now we're ready. If anybody has any questions, we're happy to respond to them. I think we're going with questions from the press first, just to start.
Could you give us some backstory of how this came about? What was the reason for it after so long? Why now do they want to demolish it?
I think the folks from the New York Pioneer Infirmary.
Can you repeat the question, please?
Why do they want to demolish it now? Why now, of all things?
I can try to best answer that. So the reasons that we've been getting from the Mount Sinai leadership is it's financial. It's increasingly challenging to serve poor patients and stay profitable. The majority of the patients that come to the clinic are underinsured or not insured. And it's a money-losing operation for the healthcare system. So in order to stop the losses, they want to move us out, and then if they sell, they will get a huge chunk of windfall from that and minimize further financial losses to the healthcare system. So remember, Mount Sinai health system is a very large health system. It includes Mount Sinai Hospital, Mount Sinai West. They're all renamed now. Mount Sinai West, Mount Sinai Morningside. There's downtown is now what used to be at Israel. So it's a conglomerate healthcare system. We've been asking for some transparency about how the other hospitals are doing financially, because it seems that they're it is, but kind of pointing the finger at us and saying, you're losing money, you need to move out. In a recent email with the president, I've asked for some transparency about the finances of the other hospitals. But the bottom line is that New York Pioneer is, based on their budgets, again, we want some transparency, because we're taking care of many poor patients. It's financially a loss for the healthcare system.
And just follow up to that, how long have you guys been fighting this, and what has Mount Sinai's response been to your
So there was a plan for transformation before the pandemic, but then the pandemic put everything on hold. After the pandemic settled down, there was a town hall with Mount Sinai leadership, with the public, alumni, residents, faculty, last fall. So they renounced these plans of moving us out last fall. I remember when it happened because my phone blew up amongst like 20 alums, very angry alums texted me and said, what is going on? And I said, let me find out. So it was announced last fall. We've been having behind closed door meetings. Many of us have been meeting with them individually about our concerns. But it looks like they're still proceeding. The plan is, I think, to be out by November 2023.
I think Paul's being, I don't want to be talented, but we've had discussions. And it's not just that, in some cases they're not responsive at all. When they are, it's very draconian. Paul had an interaction with one particular higher up, which was actually quite open. So one of the major issues here has to do with a culture, us, versus a culture that's clearly corporatized, and they will make all the decisions. One of the things about the Pioneer Infirmary is when there were decisions to be made, we were all brought together. And we had differences of opinion, but we worked them out amongst ourselves. What Sinai is saying is, you're too little and too small and you don't know anything, so move out of the way. We can't find anything about the finances, which, by the way, are supposed to be a public record with the Department of Health. We can't even find out the real numbers of patients moving through the system. So there's this obfuscation. And I understand, and I'm going to, this may be annoying to some people, I understand they have a problem, but they're not sharing the problem with us, because we solve problems. We've done it for 200 years. If they would sit us down some of the leadership, the young leadership, you're getting gray though, and that's okay. Some of the younger leadership, who the future of whatever the infirmary might be, I think there are innovative ways to move into the 21st century. We're going to have to be different. And by the way, that's an advantage. Instead of sitting there losing money, start talking about what can we do to provide services to this community and the environs, because we have patients coming from everywhere. If we do that as a group, the user bees, the people that are in the front. It's like the Russians trying to fight the war. They don't have their generals at the front. You've heard the story. It's one of the reasons they get bloody noses. And we have the same problem. We have middle-level management all over the place, and yet we're the ones who know what's coming.
It's ironic, the infirmary, decade and a half ago, joined up with Continuum. We feared being carved out. We were an independent hospital with our own board, and we were doing fine, I thought. So we joined Continuum. Continuum was bought out by Mount Sinai, and our feeling, not mine personally, but the general common wisdom was that we needed to join something big, a network, to survive in this environment of decreasing reimbursements, increasing costs, things like that. And the other question is, how come Baskin Palmer and Wilmer and Wills Eye and California, Maryland, and Texas programs, similar to ours, connected to large medical centers, are thriving and surviving? What happened? Now, we can get into more details of some of the things that happened before last fall, like stopping the PC, the arrangement of having the attendings work for a decreased fee. We were willing to do that. But I think Dr. Coughlin hit it on the head. We don't have enough information to even propose solutions. We're just being told this is the way it is.
And there's an inexorable dismantling of the system. The things that we built and brought together, the volunteers, and Dr. Buxton, we used to have an organization that ran a group of volunteers, or some people were reimbursed, but they came to the infirmary, and the hospital, Sinai, just deep six that. The trauma center has been essentially dismantled. So they're taking everything apart, throwing it away, in expectation of moving the house. That's what you do. You clean the house up, you get it ready for the truck to come, and you go. So although they have not said this openly, and we talked to a number of people, we can't get them to really define what they're going to do. But they do tell us that when they do move, that it will be in 5 disparate areas.
There'll be a chance for individual follow-up as well, so don't worry about that. But
yeah, I just wanted to ask about the spreading out of the services. So you said 5 locations. Is there something in that I could see? It was a meeting. Did they share a document of where these locations are so we can have them?
Yeah, they did.
Yes, we
There's a deck.
get this to you.
There's a deck that they provided,
Okay.
and they enumerated at least 4 places, perhaps. In some cases, they're not even sure themselves, but there are at least 4 that they defined.
I mean, I can give you the general, if we have to. So, the resident cases, which are the biggest money losers in the operating room, will now be done at Beth Israel. So Beth Israel has an operating room, or operating rooms, so they're gonna have all the resident cases moved there. The faculty cases will be moved to what's called an ambulatory surgery center. A lot of ophthalmologists now operate or own what's called ASCs. So the faculty members, because they have higher paying commercial insurance, those surgeries will be done at a separate ASC, which they've already contracted with a healthcare management company. And then the resident clinics will be at the old Ear Institute, which is, I believe, around 19th and Broadway. And so the resident clinic will be moved to 21st and Broadway, north of Union
You
Square.
sure it's not 22nd, 382nd Avenue?
382nd Avenue, I'm sorry, 382nd Avenue.
Residents of Second Avenue.
Correct.
Yeah.
382nd Avenue, I'm sorry, that's correct. So the resident cases are going to be at Beth Israel, the faculty cases will be at AAC, and the resident clinic will be at 382nd Avenue.
And some of the sophisticated testing would be done at Beth Israel, whereas now, everything's incorporated in one place, one-stop shop. If you need care, whether it's a physician specialist or a technology, we have it. But what they're talking about is breaking these things up into pieces.
They're trying to move money-losing operations to one area, extract the money-making operations to another area. And
Just a quick follow-up. Was there any talk about an option of them possibly having a new building that they were building?
Yes.
With technology there? Because it sounds, I heard that they potentially may be opening up a new facility where they're gonna keep all of these services. Did they not have that discussion with anyone there, or?
Someone had it with me, and she simply said, we cannot afford to run a multi-service, multi-diagnostic center in one building. The money is not there. It's going to cost us $70 million to bring this building up to code and to make that work. Of course, 40 of the $70 million that she mentioned is the loss that Mount Sinai would incur if they didn't sell the building. Okay, so it's kind of, you know, imaginative accounting. But I proposed that to her, and she's the chief operating officer now, and they determined that it's impossible. They cannot run an infirmary-like institution in one building.
It was an evolutionary aspect of it, starting even before the pandemic. They were originally going to sell off Beth Israel and maintain the integrity of the infirmary some way. But the State Department of Health was very concerned, subsequent to the pandemic, that you're going to need more general hospitals because we're in the midst of an ongoing element of climate change and more pandemics. And I recall, and this was almost every month, there would be sandwich boards in the lobby about the new New York Pioneer Infirmary. Apropos of what you're alluding to, there was an emergency room segment on 13th Street where the hospital was going to be the entrance. I think they were planning to sell off perhaps the 14th Street side. But nonetheless, the details aren't important, but there were, and then 2 months later it was a different set of these poster boards, and our heads were spinning because there was never explanation why it changed or what happened. And then eventually, we didn't get any information. And Douglas, in particular, has been very active in this, and I've seen his emails. You better watch turning your car on, Doug. There is no information coming back regularly. And then when you really pressure them, all of a sudden, one of those people, I saw Budinsky responded, and then Selman responded, they are nervous. They are very nervous because the employees, not us, but the nurses and technical people, they're all afraid for their jobs. They have no real job security now. They don't know what's going to happen. So they're asking us. I know that. I hear them ask you. They ask you.
Every
And
Tuesday.
we don't have the answers on it.
I have a question for the doctors. There are 7 floors, right? 7 floors in the hospital?
8.
8 floors. There's a multitude of different services that treat various conditions. If the hospital, how could they chop up all of those different floors and what goes on it and spread it all over the city when, I mean, one of my questions would be, would that be a danger to some patients dealing with certain conditions if they got taken care of in one location, part of what they needed, and then had to travel to another? So that was my chopping up what the different services on in that building would seem to be present a danger to the health and well-being of the patient.
Especially to that vulnerable population that has enough trouble moving around anyway. It actually it's a clear and present danger. And I gave the example of a patient, all they know is they can't see or they're losing their vision. They have no clue as to what's going on. So they'll go to one spot, they'll be sent to another spot, and a significant minority of our patients have comorbidities, meaning they have more than one cause of why they are losing vision or potentially could lose vision. Not to mention that they might need surgery as well.
And many of these people can't see, and they're coming with family members. So the volume that comes into the infirmary is not just the patient. There could be a child who's bringing a mother.
Some of the patients I saw came in wheelchairs.
Sure.
And my cataract, the lens replacement about 3 years ago came off. Dr. Gentili took a look, he said, go to the other side of the building. There was the cataract surgeon. So it was a 3-minute walk for me and gave me peace of mind. If he had said, head uptown, head downtown, and people coming in there, wheelchairs and canes, and we're blind with family members, it makes perfect sense what you're saying, that the hospital should remain where it is.
So I just want to make sure if anybody else from the press has any questions before we wrap up with the press questions part, and then there'll be plenty of opportunity to talk to folks. If there aren't any other questions, thank you very much. Hopefully everybody from the press got a copy of the handout, and we're here, so if you have questions for us individually, any of you, we're happy to talk to you.